Hello and welcome to this live interaction with me, Ashish Parekh, and the discussion today is again related to COVID-19. But having said that, we will be talking about a different aspect of immunity and also vaccines. Yes, everyone's been talking about how a vaccine is something that the world is looking forward to and it could possibly eradicate COVID-19. That's the general notion that a lot of people have. But having said that, that's not entirely true. The best vaccine is something that's already there in your body. Wondering what? Well, we'll discuss about that further. But having said that, let's just get into the topic first. A global push is on to develop a vaccine to slow the spread of COVID-19, and experts hope several will be ready in 2021. Yet, even with one, the coronavirus is likely to remain with us for years, demanding long efforts to find a cure for those who still fall sick. In humanity's millennia-long struggle against viruses, prevention with vaccines has been far more successful than treatment with drugs. In fact, modern medicine has come up with a true cure for only one viral infection so far. For many serious infections, the best approaches are a cocktail of drugs that throw speed bumps in the direction of the infection, due to which it reduces and its impact is much lower, and then your immune system kicks in and does the remaining job. So why do viruses give humans so much trouble? Outside of the body, a vigorous hand washing is enough to kill many. Inside the body, in fact, the immune system's long memory is enough to make a short work of the rest of it. To speak more about this, I have with me our expert for the day, Dr. Sitesh Roy, joining us live. Dr. Sitesh Roy, first of all, why is it so difficult for human bodies to counter viruses? Yes, it can be easily prevented on the outset, but once it enters the body, it becomes pretty much difficult for the immune system to respond to it, especially if the viral load is much high.
Yes, Ashish. Viruses pose a very unique threat to the human body. The reason being that most bacteria or parasites, worms, are outside the human cell, or even if they are inside the cell, they are much larger and easier to detect and get rid of. Viruses work on a very unique phenomenon or process whereby they integrate themselves into the cells of the human being that they are infecting. And they take over the machinery of the human cells so that they can then make more, which means replicate themselves at a very rapid rate. As a result of this, a virus, once it gets into the human body and enters the human cells, takes a while for the immune system to, one, respond and create antibodies as well as what we call cytotoxic or killer cells, which can then get rid of the virus completely. And it does take anywhere between 7 to 14 days for a person with a healthy immune system to do that. In this process, if a person's immune system is not healthy, or they have other what we call comorbid or other diseases or illnesses that make them weaker or susceptible, then it takes even longer for the virus to be cleared from the human body. And so it is the uniqueness of this nature where the virus, one, becomes part of the body, two, has its own defenses to kind of subvert or hide from the immune system, three, where it can mutate and change itself so that when the antibodies are formed, it changes its structure so the antibodies can't hold on to it or trap it, or make it more prone to get killed by the immune system. And through all these mechanisms, the virus poses a very unique threat to the human body.
So that was, that was just us speaking about viruses in general. The current coronavirus is the latest in a procession of, in fact, new infectious diseases that have surprised the world in the past few years. And our best hope against it is a vaccine, of course, which can stop infections before they take hold and we succumb to it. In fact, some vaccines, such as that for measles, have created enough herd immunity that the virus can, no longer take hold and spread in the population. In the best case, in fact, as with smallpox, the shots have driven the disease out of the human host population and pretty much into extinction as well. Now, remdesivir, the only drug in wide use that somehow targets this particular coronavirus, works by messing with the virus's ability to replicate. If I'm right, it also causes errors when the virus tries to copy itself. And of course, we've had a lot of data coming in from clinical trials which have said that remdesivir can in fact help hospitalized COVID-19 patients recover much quicker than ones that are not actually using it. But it's, at the end of the day, it's not a cure, and it's highly unlikely that there will be any cure anytime soon. So again, coming back to the immune system, our immune system is in fact, most people call it the world's best drug maker. It's not a coincidence, in fact, that many infections last for about 2 weeks, and that's how long it takes, in fact, for the immune system to kick into gear. So Dr. Sitesh Roy, again, this brings our immune system into picture, because no matter how many vaccines you develop, no matter how many cures that a lot of companies are promising, at the end of the day, it is our immune system that has to do the work, and our immune system that is the number one antibody or number one vaccine that we have, isn't it?
Very true. First, on the point of vaccines that you mentioned, I would like to say that from the time that the first cowpox vaccine was developed for smallpox in the late 1900s, 1897, it took us almost 130 or 140 years to get to the point where we were able to clear some of these viruses that you said and get rid of them from the human race.
Yeah.
Smallpox took almost 100 plus years. Measles took almost 4 to 5 decades. So you have to realize that even when a successful vaccine is there, to give that successful vaccine to 7 billion plus people is going to take years to happen. And so in the meantime, there are a lot of antibody concoctions that are being made. There are a lot of drugs that are being looked at. In the very latest research of a drug that has been used to treat fatal cat coronavirus might be something that might work very beautifully for humans. At least it is in vitro, in a petri dish. So trials will now take place. It will take about several months to a year to know whether it works. But as you rightly said, it is ultimately our healthy immune system. We are blessed with an immune system that has immense flexibility and ability to adapt to all kinds of infections. So from the time we are born, we are exposed to hundreds and thousands of bacteria, viruses, fungi, parasites, and our immune system has a wonderful mechanism called innate and adaptive immune response, by which it responds to these bugs and fights them off, and also develops some memory, so that the next time the virus or bacteria enters our body, it is able to respond in a much faster manner.
Absolutely.
So we are in a place where, because COVID-19 is so new to the human race, so many people are getting infected. But as time goes by, while people get vaccinated and vaccines reach all the people in the world, and it will take some time, it's ultimately keeping our immune system healthy through a healthy diet, healthy lifestyle, natural supplements, exercise, good sleep, good hydration, positive thoughts, meditation, prayer. So many things influence our day-to-day life, our immune system, and really that is our best, our very best fighting mechanism. And that's what I do day in and day out with my patients, is working with them to keep their immune system at the best that it can function.
Yeah. You also made a very interesting point, Dr. Roy, about the memory of the immune system. In fact, the antibodies that are developed remain in the reserve, in the immune system, and in fact go on patrolling for years. And in case the threat returns, it again goes back and it attacks the threat, and it makes sure that we are free from it. And this is pretty much the exact process that vaccines also mimic. The man-made immunizations in fact offer a piece of the virus to the immune system, providing just enough for the body to activate against the potential threat without actually making the person sick. And the immune system is thus alerted and able to prevent infection, rather than having to fight one off against the entire virus. So immune system, we are talking about vaccines, how they function. They pretty much mimic what exactly immune system does. It is not something incredibly extra that your vaccines are doing. It's pretty much doing what the immune system is doing, isn't it?
true. The vaccine basically gives the immune system, as you said, a soundbite of the microbe, whether it's a bacteria or a virus. It gives a small piece of it so that when that virus or bacteria in its entire self tries to enter the body already is primed with memory immune cells and antibodies to mount a very rapid response to the virus or bacteria and clear it. The only issue with this, Ashish, that has been a challenge for the entire medical community and us as immunologists is, for example, if you take the HIV virus, we have known about it since the last 39 years, but we still don't have an HIV vaccine because HIV, which is also an RNA virus, is very smart at mutating itself, and the moment we have enough antibodies against the sections of the virus that we target by the vaccine, the virus changes itself and becomes immune to the vaccination. Now, fortunately, SARS-CoV-2 and COVID-19 has not shown that ability to do rapid mutations, but still it will be a matter of time, and I really hope that whatever vaccines are developed against the spike proteins, which is the primary target that most of these vaccines are looking at, because that's how it attaches to the human cells and the ACE2 receptors in the human cells, we can only hope that the virus won't mutate itself so that the vaccines also can potentially become ineffective and we will have to go through the entire vaccine development process again. But I do believe that ultimately for the most rapid immunization, vaccination is the best bet, and the work on the medications and everything else is going on side by side. And all in all, we can only hope that with the fewest lives lost, we can win this battle and bring the world back to a normalcy again.
So, Dr. Roy, before we wrap up, this the way you explained it sounded like this is like two races happening parallelly. Now, on one hand, you have to develop a vaccine fast to make sure that more and more people are saved. On the other hand, the reason why we need to develop a vaccine fast is to make sure that we do it before there is any sort of a mutation, which means that again everything would be back to square one, and again they'll have to restart the entire process of vaccine development from the scratch, and that would mean pretty much it would have catastrophic impacts, wouldn't it?
Hopefully not a catastrophic impact, Ashish. The reason being, with influenza, it also undergoes mutations, and every 6 months, there's something called Northern Hemisphere viruses and Southern Hemisphere. These are strains of the influenza virus, which do undergo what is called a genetic shift and a genetic drift mutation. So new vaccines have to be developed, and we have gotten so good at it that once a year, depending on the part of the world you're in, a new vaccine is released by which a person has to every year get a vaccination. We don't know whether with SARS-CoV-2 we'll have to do the same thing. That is something that time will tell. But hopefully we won't have to recreate the whole wheel again, because we will have done it with one successful vaccine, and it will only mean that there will be some more work that will have to be done to get the latest strains or the latest mutants into the vaccine for the subsequent season of the COVID-19 or coronavirus.
All right. Thank you, Dr. Roy, for your expertise there. So clearly, that was our expert for the day, Dr. Roy, who's clearly explained as to how exactly, viruses impact your body, and also how vaccines are dealt with as far as, viruses are concerned. Because, of course, the focal point right now for everyone is COVID-19. But when you take the larger picture, when you take vaccine behavior as, virus behavior, in fact, as a whole, and compare COVID-19 to it, we can probably get some sort of an idea as to how we should be going about the entire process of getting rid of this particular virus and also saving ourselves. And also what that brings into perspective at the end of the day is that your immune system is probably the best vaccine you have at this point in time, and your focus needs to be on making sure that you develop your immune system and keep it robust to make sure that you stay safe from the virus. Because yes, in fact, even after, Dr. Roy clearly mentioned, even after the vaccine comes, for example, with many other viral infections, even after the vaccine comes, there are several years that there has to be regular doses and a lot of work, legwork, that has to be put in to make sure that the viral infection is eradicated. In fact, it takes many years. So even if a vaccine comes, coronavirus will remain around for a very long time. So the only protection, the only vaccine that you need to rely on is your immune system. Do let us know what you thought of this live interaction, and also leave behind your comments in the comment section below. Do not forget to like, share and subscribe to News 9 Digital. Thanks a lot for watching.